After your surgery, it is normal to have some swelling in your hip and thigh. This may increase at home as you become more active. You may also have black and blue bruising. This usually goes away over several weeks. To help prevent and reduce swelling, change positions often and do not sit with your feet on the floor for longer than 45 minutes at a time. Get up and walk, then rest, ice and elevate your leg. Perform ankle pump exercises every hour. Pain is expected during the first 6 weeks after your surgery. Your team will develop a plan to help you manage it before you are sent home. It is also normal if your hip feels stiff. Swelling can cause your range of motion to be limited. This might get worse over the first 2 weeks, but should get better after that. Your rehabilitation therapist will work with you to stretch your hip and get it moving. They will also give you instructions on which positions to avoid sitting or laying in. Your surgical leg might feel longer than your non-surgical leg for the first 6 weeks after your surgery. This is very common. Tightness in the muscles around the hip joint can cause your pelvis to shift. Time and stretching should help. Don't use a lift in your shoes to make your legs feel even, and tell your doctor if you're worried. You can return to sexual activity when you feel ready. Just be sure to follow the position avoidance guidelines provided to you by your health team. To recap, swelling, pain, and stiffness are normal. Rest, ice, and elevate your leg and change positions often. And it's important to keep moving.